Today, we're going to talk about reducing opioid use using medical cannabis. So there's a growing body of research around decreasing opioid use and narcotic use, specifically using cannabis. We've written a guide at utahmarijuana.org, and through this video, I just want to go through this guide that will help people reduce their opioid use with medical cannabis. So the first thing to know is we need to set some expectations. Cannabis use is not going to be the same. It won't feel the same as the opioids that you're already taking. There is an addictive quality to the opioids that are taken, and there's a big risk of stopping those altogether. So no matter what we talk about today, be sure to talk to your medical provider and your pharmacist before you stop the use of any opioids. First off, I like to make sure that people understand that this should be a written plan. We're going to plan this out over a little bit of time, 4 weeks at a minimum, 8 weeks, 10 weeks, sometimes 6 months to get people off of high doses of narcotics. Say if you're taking 120 milligrams of Percocet or oxycodone per day. Start with a 10% reduction in that opioid use. Once you get an understanding of what your therapeutic use of cannabis is, you're going to find your just right dose of cannabis, usually between about 5 milligrams and 15 milligrams of THC. Once you understand how you're using that and you're still taking your opioids, you're going to decrease by 10%. That will start the process of reducing the opioid use. Remember that opioids are going to feel a little stronger with a little bit of THC on board. And yes, it's usually safe to use both of these together. Your cannabis is going to help those opioids feel a little stronger and last a little longer. The second thing I tell my patients is to be consistent with the cannabis use. Take something 3 times a day, plus use an inhaled method for breakthrough. And then reduce your opioids on a planned schedule. It's not going to be 100% comfortable, but it's worth it in the long run because the negative effects of the opioids, including liver failure, kidney dysfunction, and GI upset, these are things that can cause major problems down the road. So it's really important to reduce these opioids specifically. Let's talk about an example. In our guide, we use Nora Norco. She's using 30 milligrams of Norco per day, and she wants to reduce her use of that Norco with using cannabis. So she found that her typical dose of cannabis was about 15 milligrams, and that was the sweet spot, the just right dose. So she's using 15 milligrams of THC 3 times a day, and then she's still using her Norco so that she can understand what it feels like and then reduce that Norco week after week. And it took her about 3 months to get off of her opioids completely. Another example that we used of a higher opioid consumer or patient was Oscar oxycodone. And Oscar was using 80 milligrams of oxycodone per day, but was using cannabis in the same way, but also had to use some inhaled methods as breakthrough, some vaporized flower or a vaporized cartridge to really hit those times when the pain was just flaring up. A couple of other things to note is when you have those breakthrough symptoms, if you're at work and you can't use the psychoactivity of THC, try some extra CBD. Try doses in the 100 to 200 milligrams of CBD, either inhaled or oral, to help fight that breakthrough withdrawal symptom from the narcotic. This can really be helpful. The last thing I'll say is sometimes people really get discouraged because they find after a few weeks of reduction, they have to go back up on their opioids. Don't worry. Everything is really individual. This might take 6 months, this might take a year, but it's important to reduce the use of opioids over time and give it a try. Follow up with your provider, follow up with your pharmacist. Try to use different products in the cannabis world to help go through that process. And if you need more help, then you can find our guide at utahmarijuana.org/guides. You can download this opioid guide, which basically goes through the same things I've talked about, some of the things to look for, some helpful tips and tricks, And if you have a tip or a trick that you've used to get off of your opioids, we want to hear about it. Everybody needs to be aware of the opioid crisis in the US and be working towards getting people off of opioids that are killing people and moving onto a drug that's safer, that has less long-term side effects, and can be really helpful.